So one change that I would make to the healthcare system would be universal EHR, electronic health records. In my field, we're constantly looking for records for patients from infancy, and usually that can put a damper on treatment and it can actually delay treatment. So having a universal EHR would definitely help to expedite that process. A universal EHR would allow continuity of care across the nation. So like if I lived in Michigan and I went to Florida to get for vacation and got hurt, I could actually go to the emergency room in Florida and they could have access to all of my records. They would already know my pre-existing conditions, allergies, I have a current list of my medications, and kind of have a general picture as to what's going on with my health. This would help to ensure continuity of care across the nation, and it wouldn't just be like St. Joe's versus UK. Everyone would have the same platform and same information. So there aren't really any studies that have been done on a large universal electronic health record, but there has been one done on a smaller scale. So there was an EHR that was done with four practices, and that showed that the EHR team communication flow patterns might be an important avenue to explore in raising quality of care and lowering costs for patients with diabetes and primary care. And that was done by Marlon Munt. This may also help with research by ensuring that all the pieces of the puzzle are there with the care. It's like I said, it's hard to get records for patients, so if they come in, they're a research subject, it might be really hard to track down all of the information that you may need. Legal implications would be cost implementing the system. You have to train new employees, you have to train your existing employees for that EHR. If you've just switched over to Epic and they're utilizing something else across the nation, that's going to be costly. And then ethical, this may be a HIPAA violation. So if someone in Arkansas wants to access my chart, it may be they have access to it, and that could potentially violate HIPAA. It puts you at a higher risk. As far as talking with the nurse leaders of the organization about my predictions related to changes in nursing care, nurses are being held more responsible for infections acquired in hospitals, patient falls, and readmissions. Nurses are more involved in leadership and protocol changes. They're held to a higher standard of care delivery, and procedural practices are more regulated. Hurdles in the nurse's role could be lack of staff, lack of resources, and lack of engagement. For the type of nursing delivery model that I believe that will need to be in place by 2020, I believe that the team nursing will need to be in place by 2020. This will help delegate certain tasks such as vital signs to CNAs or UAPs. This will help the nurse to focus on educating the patients and focus more on training on new medications and patient-centered care. Which this in turn can also help patients to have better outcomes and prevent readmittance to the hospital. So if a nurse starts a patient on blood pressure pills, she actually has that time to spend with that patient to educate on that medication, what to watch for, side effects, how to take it, when not to take it, all of those parameters, and what to watch for versus having to rush off to do vital signs or give a bed bath to a patient that may need it. That CNA is there to kind of help with that, and the nurse has more time to teach. This will help to potentially lower readmittance to the hospital, and your patient is more educated on their medications. Types of restructuring activities that my organization would need to be involved in is new protocols to ensure standard of care with every patient, training employees, and hiring new CNAs or new nurses, just to make sure that everybody's on the same page and every patient is treated the same way every time. Criteria that we can use to measure the effectiveness of nursing care in the organization is the occurrence of in-hospital infection, falls, readmission rate, patient and staff satisfactions. This could be indicated by nurse-sensitive indicators. And then again, hurdles would be lack of staff, lack of resources, and lack of engagement. But again, your nursing-sensitive indicators and surveys could all measure all of that.